Hello and welcome to another episode of the Health Notebook. Today we have Anita Prag in the studio and we will be discussing some basic aspects of psychology. Anita Prag is a clinical psychologist and she's currently doing her PhD in empathy and prosocial behavior in toddlers. Anita Prag, welcome to the studio.
Thank you for having me.
Can you just explain to us a little bit? I know you've informed me before the show that you're doing your PhD in empathy and prosocial behavior in toddlers. Can you just elaborate a little bit about that, just to inform the viewers as well?
Sure. So prosocial behavior essentially is behavior that leads us to better relationships, essentially. So if you think about sharing, is basically an essential skill that we learn, and it's embedded in us. And there's a way to potentially enhance that, and we need to kind of try and understand how that actually develops and how it can be enhanced through relationships within the nuclear family. Essentially,
Okay. And are you almost done with your PhD? Or?
Oh no, this is my first year. So I'm just starting and in the process of collecting data.
Okay. Can you just explain to the viewers where you've come from and where you are now? As I've informed them that you are a clinical psychologist. Can you just elaborate? Where are you in your career now?
So I got back from overseas and then applied to do my master's, and essentially the process from therein is doing an internship, 1 year community service, and then I worked in a state hospital for 5 years, and then decided private practice was the next move. So I've been in private practice for 3 years now.
Okay, and in your private practice, what cases do you see, or do you cover the broader aspect of psychology?
I do. I quite enjoy working with a range of age groups. So starting from about 5 or 6, and I've kind of seen people into their 60s and 70s, males, females, and pretty much anything that you're struggling with.
So you cater for a fairly broad segment of the population. Now, I think it's important to inform the viewers. There is this misunderstanding between psychology and psychiatry.
Right.
Can you just elaborate a little bit more about the differences between the two?
Sure. So psychiatry, essentially, you have to be a medical doctor, and then you specialize into psychiatry for 4 years after you've completed medicine. And with psychiatry, it's important for diagnosis. So if someone's really ill, they go to a psychiatrist, they'll get diagnosed, and then if need be, put on medication. Something that's appropriate for, where the person finds themselves at. Sometimes a psychiatrist needs to admit a patient because the illness is really quite serious, of the psychotic nature, say for instance, or a very serious clinical depression, and the person needs to be admitted and taken care of within a treatment facility. And then a psychologist, but psychiatry and psychology needs to work really well together because they can't really operate without each other. A psychiatrist needs to be able to refer to a psychologist where necessary because, medication is not always needed. A course of therapy can be really useful to alleviate symptoms, essentially, and to take a person through a process of growth and development. And then obviously a psychologist needs to work really well with a psychiatrist as well, because if you meet someone in therapy who needs medication, and we need to understand that sometimes therapy is not enough.
Okay, so when you mean therapy, can you just elaborate types of therapy, or say for example you have a patient come to you, what differentiates the therapy that you provide? Yes, I understand the psychiatrist will provide medication, but just elaborate in terms of the process. You have a patient, the interview, what do you focus on, which areas do you go into, and just the thought processes behind it as well.
So it's the whole process of therapy is actually very interesting, and depending on who you are, where you're at, and what your needs are, it's quite good to explore your options. And so there's a lot of information out there on the internet these days with regards to, whether you need cognitive behavioral therapy or If you're into something that's a little bit more process-driven, if you're interested in classic Freudian therapy or Jungian therapy, or somebody who's a little bit more eclectic. And, yeah.
So there's different types of therapy aimed at different individuals and age groups as well. Okay. We'll move a little bit along, and I just want to know, in terms of treatment, right? I know the current perception of the general public is that you need to be ill to be seen by a psychologist. What's your thoughts, or what's your opinion about it? I know South Africa, we're living in a different environment where first world psychology is a little bit different. Can you just give us some background in terms of prevention side?
Sure. If we think about life and how we live it, we take it for granted that it's something that just comes naturally sometimes, just to kind of live effectively. And my opinion is that it's actually an art, and we don't always get it right, and it's okay to not get things right, because we can learn from mistakes, etc. But we live in relation to other people, so we live in community, and where we come from affects our perception of ourselves and then our experience of the world. And therapy can help with regards to helping someone grow through certain relational difficulties. So we don't have to be ill. You don't have to have depression or an anxiety disorder or something along those lines to decide, well, something's not right with where I'm at in my life. And let me go and talk to someone and see how I can actually get guidance into to figure my way out of this situation I find myself in. I'm not getting along with my family, or I'm not getting along with friends, or those kinds of issues.
Okay, so you would identify sort of the soft issues, and then you would provide them or equip them with the softer skills, or you would give them the tools to change their thought processes and further approach. Would you say it's something?
Something along those lines, but essentially therapy is an empowering process. So it's not about someone else giving someone tools. The therapeutic process is the therapist is sometimes a catalyst. We get history, we understand where the person is coming from, what their life experience has been, and while not focusing and getting stuck in the past, it's about using what we've experienced to then put into our future. So it's not about me giving anyone skills. It's through the conversation the person starts to understand how they operate, what makes them tick, and how they can adjust that to make their lives better.
Enabling them and empowering them. Okay, can you if you can just inform the viewers, what type of patients would you see? Some examples in terms of medical conditions as well.
Sure. So it can literally range from somebody who's been under severe pressure and stress from in their various areas of life, work, home, those kinds of daily life grinding you down kind of situations, and then that can turn into a depressive episode, say for instance. And so we struggle sometimes to adjust to something that has happened to us in life, and so we need to learn coping mechanisms on the one hand, but then the deeper part of that is sometimes kind of understanding why we're struggling to cope with the daily grind of life, and that's when it gets a bit intricate, to understand where the person is at in their functioning and how they relate.
So you would cater for the normal everyday issues as well as the specific medical conditions.
Yes, so depression, anxiety. Someone may come to me via family member who thinks that, well, this person is behaving in a slightly way that is not helpful to them at the moment, and I guess someone might kind of term it odd. And then they come and that's when I would do an evaluation. You do a clinical interview to try and rule out what's actually happening diagnosis wise. And then you formulate an understanding of what is happening to this individual and for this individual, because this is a life experience.
Yes.
And obviously someone's in distress, and you have to be compassionate to that. And then you decide from there, well, do I involve the health professional, or do we engage in a few more sessions to assess and evaluate further? And then you work in conjunction with another.
Okay. And in terms of children, what range of medical conditions would you see?
So unfortunately, children these days are, put under a lot of stress, and they kind of struggle sometimes with school pressure and extracurricular activities, and obviously a child comes from a system.
Okay.
So, sometimes we're dealing with anxiety issues in children, actually more depression, or depressive symptoms in children. Also, there's scholastic difficulties, there's bullying at schools, and children struggle to manage that. So you want to kind of help them build a sense of self and a sense of confidence in who they are.
And also preventing that particular anxiety to progress into adulthood.
Precisely.
As well.
Yeah, and then we have to also, you don't just treat the child in isolation, because like I said, child is part of a system. And so you do then need to, involve very much the parents. So I'll never just look at the child. You look at where the parents are at. You have to chat to them and help them understand where the child is at, and that they're very much part of the healing process for this child.
Yes.
Oftentimes, parents need guidance in terms of what they're potentially doing to add to the situation for the child. So.
And that would empower the child to get over
to move through it, and have a voice as well.
And there is this particular notion that if you see a psychologist once, it's going to be solved. I mean, your rationale behind it in terms of follow-up as well and compliance.
Well, sure. I mean, if we have a think about, and like I was saying earlier, life is a process, and so it's so important to intervene as early as possible, because a good example is if a ship is kind of sailing in one direction and you shift its direction by half a degree now, 2 kilometers down the line, it's actually, made quite a significant change. And we can apply the same metaphor to personal growth and change. You make a small change now and you keep implementing. You're going to really grow and develop. And so I guess with children, yes, follow-up is super important, but just for grown-ups, I mean, I think we engage in a particular process, maybe for 6 sessions, and see where we're at, evaluate, then decide if further is needed, or you're okay. But the door is generally always open. Once we keep on learning and growing, so you can always check in with your psychologist.
Okay, so you don't need to see just to inform the viewers, you don't need to see a psychiatrist to be referred to a psychologist. There is always the option of going directly through to a psychologist.
Absolutely. Many times clients come through their GP because they present as well with physical symptoms. I've got headaches, my neck pain, and they go into spasms, so it somaticizes into the body. And the GP needs to be able to identify that, well, maybe this is a little bit more stress related, or actually you're struggling with some depressive symptoms, you're not sleeping well, you're not eating well, there's a lackluster in life, etc. And that's when medication is not necessarily needed immediately. Actually go and talk to somebody and engage in a process. Okay,
so it's more of a preventative measure as well in certain instances.
Could be, absolutely.
Okay, well, I just wanted to touch a little bit on bereavement, on the process of bereavement. Can you explain to the viewers the concept of bereavement, obviously, and then also the different stages in terms of bereavement?
Sure. Well, bereavement is, normal. So you've lost someone, or so physically you've lost someone, or there's been, another kind of loss, or any major change in life sometimes, which, we take a knock at. But say, for instance, just for the case of you've lost a loved one. Initially, it's a deep shock and a deep kind of hurt, and many times we're in denial. And we get stuck in that place potentially. You don't want to actually, deal with the fact that you've lost someone. And then we kind of can move through that, and you get really angry, and you get angry at the world, angry at the person for leaving you, angry at God maybe, and And then once you've worked through that, sometimes you kind of, there's some bargaining as well. I wish we could have this person back, say for instance, or the situation back. And then there can be some resolution. But bereavement it's a sad process. We need to mourn, and mourning is normal, and it means that life's going to be tough.
When does it become an abnormal bereavement?
It can, it's a difficult one to answer because obviously we all respond differently. So I wouldn't necessarily call it an abnormal bereavement, but it gets complicated because it doesn't kind of come through the process and resolve. The thing is, bereavement comes in waves as well. So you might actually find yourself being okay eventually, and then there's, a year down the line, there's a trigger. And then it kind of smacks you down again. So sometimes it gets a bit complicated when it starts impeding general daily functioning. Life becomes far too complicated to handle. And it's so very different to depression. But it can turn into a depression eventually.
In terms of the average person in the normal everyday life, how does he or she know that they might have to see a psychologist? I know there is the referral path via the general practitioner and medical practitioner. Just to empower the viewers, or just to give them some information, when is the time that they might have to see a psychologist?
I mean, I can give you a cheesy answer and say everybody needs to see a psychologist at some point in time. Just because if we take the approach of, life it can be challenging for anybody, not just somebody who's struggling with a particular, disorder, say for instance, that we all need skills to live effectively and to grow through certain situations. And life happens to us. We go to school, we need to make a life for ourselves, and even though something's not necessarily terribly wrong with your life, we can always grow. And so if one approaches life from the attitude of how can I be the best me, essentially, and am I living authentically, am I doing the best I can with what I've got and who I am. Sometimes we struggle and we stumble, and these things are sometimes subtle. We ask, why does this always happen to me? And the same patterns keep happening. And we don't necessarily introspect and go, well, we blame the outside world, we blame everyone else, and we don't necessarily go, well, what's my responsibility in this? And
so when you mean introspect, if you can just explain to the viewers, what does that actually mean? Yes.
So introspection is essentially looking inward. It's about trying to understand, who am I? What makes me me? What makes me tick? How do I make the choices I make, the decisions I make? How do the choices and decisions I make affect my future? Because if we are approaching life from a learning perspective as well, and kind of going, well, I'm continuously learning from my day-to-day experiences. Road rage is a really good example. How do we handle, really bad driving on the road without losing the plot? And getting really angry sometimes. These are small things that we can actually understand. This particular thing that this person does really irritates me.
How do I handle it?
How do I handle it? Is it them or is it actually me? And how do I kind of shift parts of myself so that thing doesn't actually bother me anymore? So I think that's what I mean when I say, we all can, because we live, and so therefore life is hard sometimes. How would you, or if you can suggest to the viewers, how do you find a good therapist? That is also a very good question, because there are lots of us out there, and because there are maybe differing schools of thought on how we understand human behavior, and so we need to maybe do some research and make some phone calls, phone people out there. Either you get a referral from a doctor or you Google. And you kind of see who's out close to you, and you give them a shout. And you maybe quickly have a chat to them, and you see if there's a connection, or they sound like they're actually understanding you.
Okay.
So you go to a therapist and you're allowed to have one session, say for instance, and if the match is not good and you're not feeling comfortable with the person, you're allowed to change and go and find somebody who you feel a little bit more comfortable with. Therapy can be a difficult process, and a lot of times the interaction brings up patterns for us, and so therapy can get quite hair-raising sometimes in terms of interrelational issues, and there's major growth that can happen when you work through that with a therapist.
Okay.
So that's really kind of getting into the nuts and bolts of life.
And in terms of decision making, when you see an individual, the decision maker still remains the patient.
Absolutely. A therapist can never tell you what to do. If I see somebody who's being, a woman who's being abusive, for instance, I'm never going to tell her, leave your husband, because life it's yours, and you need to be making your own choices and decisions, and you need to take responsibility for your own life. So the therapist is a catalyst and helps you get to a place where you can make certain choices and decisions and learn through skills, or skills development essentially, and so a therapist must never tell you what to do.
We've almost reached the end of the show. Can you just give the viewers a summary of psychology, or a take-home message so that they feel empowered as well?
Life can be beautiful, but it's also difficult sometimes to navigate, and there's no reason why we can't, grow and develop through what our experience is. We all have a story, and we all have something to share as well in terms of where we come from, who we are, what's influenced us, and I think psychology can help, or that introspection and going through the process of actually growing through yourself and trying to live authentically. That's what psychology can actually help you do, and unfortunately the stigma is that if you're sick, that's when you go to a psychologist, and that's not necessarily the truth of it. So there's a lot to gain and learn through life.
Anita Prag, it's been a great pleasure having you on the show. We hope to see you again in future shows. Thank you for watching. Stay tuned for another episode, same time, same place.